This video is going to go over how to enter problems into CareManager. Problems are simply what we refer to as diagnoses in the CareManager system. Before we get to the actual demo in the UAT here, a few things we wanted to make sure were clear regarding the entry of problems or diagnoses into CareManager. First and foremost, any problems that we enter, we must have supporting documentation on file from a licensed provider or another source such as HCSC, Healthy Connections, the Managed Care Organization, or maybe Epic Care Link, or wherever you go to get them. But we have to have something that proves that what we're entering is in fact confirmed and accurate for that member. This is very important because, as you are aware, HCSC and CareManager speak to one another. You're probably most familiar with that relationship in terms of the receipt of information. So you're getting alerts in CareManager when your member presents to the ED or is admitted to the hospital. On the back end, we are also sending information out to HCSC, and some of that information that is sent includes the problems that have been entered into CareManager. So for that reason, we want to make sure that what we were entering is accurate and confirmed through supporting documentation, because once we enter it in CareManager, it will now live in the member's HCSC chart until the end of time, really. It's never going to come out of there. So we want to be very, very careful. Another thing with problems is that in CareManager, they are very, very difficult to get out once you enter them. So we want to be sure we are very accurate and confirmed this information before we put it in, because once we put it in, we cannot get it out. This is because problems get tied to things in the back end of CareManager, such as billing information and your plan of care objectives. So again, once you start putting more information into the system, you will not be able to get these problems out. Along those lines, the other thing we say about entering problems is less is more. Right, you don't have to go crazy entering a ton of problems into CareManager. You really want to focus on what made the member eligible for the program and what diagnoses are on that chronic condition list from New York State. So before you go to enter any problems, I highly suggest that you go to our website under the policies and procedures and look at policy B2. That's our eligibility policy. The very first attachment, attachment A, is the list of chronic conditions from New York State. So confirm that you've got supporting documentation for diagnoses on that list and focus on entering those. And you can enter others that you maybe aren't on the list, but you know you're going to be working on them with the member. That's fine too. You just don't need to enter a ton of problems into CareManager. Also on our website, we have a problems tip sheet. It's located under the engagement and enrollment section. I recommend taking a look at that too. It's just a quick do's and don'ts for entering problems. It covers the things we spoke about here today, along with a few other tips for entering problems into the system. All right, so all that said, we will move over to the demo. I'm in my test chart here. I'm going to go to the Problems tab. And much like everything else in CareManager, I'm going to start by clicking the plus New Problem button. First thing I want to point out is the first problem you enter is going to automatically be the primary one. And this gets tied to billing things. So again, just think about what's the major, chronic condition or what's the major concern and entering that problem first so it'll default to your primary one. The problems field here is going to search a database in the background. So when I start typing in something, it will pull up a list of things that might match that description. So I'm going to pick the one that comes up. And then you see down here, I have a list of ICD-10 codes, and it asks me to pick the most accurate one. Hopefully, the ICD-10 code will be listed on the supporting documentation that you already have on file and uploaded into CareManager. If not, Google is a good option to pick the closest one. We'll do unspecified for our purposes today. The date of verification and the date recorded are not super important. You can put the date that you're entering it. You can put the date that you discovered it. You can put the same date for both. Doesn't really matter all that much. The problem type is fairly straightforward. For this one, it's going to be a behavioral health. The other options are physical health or social health. The next three fields here, the chronicity, onset, and severity, don't really matter all that much. They are required fields, but they're not ones that we reference. They are not sent to HCSC. That level of detail isn't sent out. So you don't have to spend a lot of time kind of phoning over records to get the correct information. You can really just pick, to the best of your ability, what do you know about this particular diagnoses. The status is where you can choose to be active, inactive. Remember, chooses not to address. We'll go with active for now. And that is it. I just save and close, and I have my first problem entered. I'm going to do another one to show you some other kind of functionality here. So let's say my member here has a substance use disorder, so perhaps cocaine dependence. Again, for date of verification and date recorded, I'm not going to worry too much about them. Problem type, I get a lot of questions if this is behavioral or physical. It doesn't really matter that much. I'll go with physical because it's an addiction. Again, chronicity, onset, and severity don't matter all that much. I'm going to do my best guess here. And then in this one, the status dropdown. So maybe cocaine dependence is a qualifying condition for this member. It is something that has caused her to come to our attention and receive health home services. So the expectation of New York State is that we be addressing this diagnosis and her other qualifying diagnoses. However, maybe she's not ready to deal with her addiction. She's not ready to seek help. This is where I can pick member chooses not to address. And that sort of communicates out, look, we know this is an issue. It's a qualifying condition. It's something she's struggling with, but at this time, she's not ready to deal with it. So I can list it as member chooses not to address, and then I won't expect to see something on the plan of care regarding it right now. And I can always update the status later if she does decide to seek help or treatment for her addiction. Again, I would look up the ICD-10 code and then select the right one and save and close. I'm going to do just one more. I'd like to do one of each. So you can also put in social determinants. So problems focus on the diagnoses that we have to have supporting documentation for. Again, those are the things that qualified someone for the program and that we're going to be addressing with them. But we also do work with social determinants. So things like food insecurities, homelessness, anything like that. You can search for those types of problems in CareManager. Food insecurity. So she has a food insecurity. We're going to need to work on that. It's going to be on my plan of care. It's going to be a major thing. So I'm going to add it as a problem here as well. Again, I'm not going to worry too much about these. This is where I'm going to pick my social health, chronicity, onset, and severity. Again, I'm going to pick my best guess, and the status is going to be active. And the Z codes are probably going to be the first one on here. And then I save and close that. And now I have a few problems entered. I could keep going if I have more, but I wanted to show you at least one of each for this purpose. And that's all that goes into adding problems to CareManager.